COVID, how NZ succeeded and failed. Are we ready for the next pandemic?
The world changed overnight. Imagine waking up one morning and the world you knew has shifted. Airports are empty, shops closed, and masks are part of everyday attire. In early 2020, COVID-19 swept across the globe with unprecedented speed. New Zealand, like many countries, faced a moment of truth. Could we control the outbreak, or would it spiral out of control? Early successes in NZ showed what decisive leadership and rapid response could achieve. But the pandemic also revealed weaknesses, gaps in preparedness, communication challenges, and societal vulnerabilities. So what lessons can we truly take from this crisis? And more importantly, are we ready if the next pandemic comes knocking? The power of early action. New Zealand's early response was a textbook case in crisis management. By imposing strict border controls, contact tracing, and nationwide lockdowns, NZ bought critical time. Cases were kept low, and hospitals were not overwhelmed. Globally, countries that hesitated paid a higher price. Italy, the United States, and Brazil saw health systems stretched to breaking point. The lesson is clear: speed matters. The virus moves fast, and indecision can cost lives. But speed alone isn't enough. It needs to be paired with public trust and clear communication. People must understand not just the what, but the why. Without that, even the best-laid plans can falter. Science, data, and the limits of prediction. We learned that science is our best guide, but it isn't perfect. Early in the pandemic, models predicted everything from hundreds of thousands to millions of cases, often with wide margins of error. In reality, the virus behaved unpredictably. Variants emerged, vaccination rollouts faced logistical hurdles, and public adherence to restrictions fluctuated. New Zealand's health authorities adapted, shifting from elimination strategies to mitigation when necessary. This highlighted a critical point. Preparedness requires flexibility. We can't predict every twist, but we can build systems capable of responding quickly, learning, and adjusting. Communication. The invisible lifeline. One of the starkest lessons from COVID-19 is that information saves lives. Confusing messages, mixed signals, and political interference can amplify fear and undermine compliance. In NZ, leaders like Prime Minister Jacinda Ardern used empathy and clarity to communicate risk, creating a sense of shared responsibility. Countries that struggled with messaging often saw resistance to public health measures. It is a reminder that fighting a pandemic is not only about labs and hospitals, it is about hearts and minds. People follow rules they trust, not rules they fear or misunderstand. Vaccines. Triumph and challenge. Vaccination was a monumental achievement. From development to deployment in record time, vaccines changed the trajectory of COVID-19. In New Zealand, rollout speed and equitable access were critical. Yet, vaccine hesitancy and misinformation slowed progress. Globally, countries with higher uptake saw fewer severe cases and deaths, while others struggled with logistics or public skepticism. The lesson is twofold. Science delivers tools, but society determines impact. Trust, accessibility, and clear communication are as important as the vaccines themselves. Global cooperation or isolation. COVID-19 exposed the strengths and weaknesses of global collaboration. Information sharing, joint research, and coordinated strategies helped accelerate treatments and vaccines. Yet vaccine nationalism, hoarding of resources, and unequal access also highlighted persistent inequities. New Zealand, a geographically isolated nation, benefited from border control, but relied on global networks for vaccines, PPE, and data. Pandemics are inherently global problems. No country is safe until every country is safe. Our future readiness depends on shared knowledge, fair distribution of resources, and international solidarity. Economic and social resilience. Lockdowns and restrictions saved lives but came at a cost. Businesses closed, mental health struggles increased, and inequalities widened. The pandemic forced us to rethink resilience, not just in healthcare, but in society as a whole. Lessons from New Zealand's economic support packages, mental health initiatives, and digital infrastructure investments offer a roadmap for cushioning future shocks. Being prepared isn't only about stockpiling masks. It's about social systems that can absorb disruption without collapsing. The human factor. Perhaps the most enduring lesson of COVID-19 is the central role of human behavior. Compliance, empathy, and collective action made the difference between success and failure. Even the best vaccines and policies fail if people don't engage. Stories from NZ communities show neighbors helping each other, volunteers supporting vulnerable populations, and a sense of shared purpose, making hard choices bearable. The pandemic reminded us that resilience is not just structural, it's human. Looking forward, are we ready? As the world transitions to post-COVID life, the question lingers: will we be ready next time? Early warning systems, investment in public health, vaccine infrastructure, and clear communication channels are vital. Yet history warns us that complacency is dangerous. The next pathogen could be faster, deadlier, or more resistant to vaccines. New Zealand's response offers hope, showing that decisive action, public trust, and global cooperation can work. But it also reminds us that preparation is never finished. Readiness is a continuous process, a culture, not a moment. Conclusion: wisdom from crisis. COVID-19 changed the world in ways we are still discovering. It highlighted human vulnerability, the power of science, and the importance of solidarity. The successes and failures of this pandemic provide a blueprint for the future. By learning, adapting, and investing in resilience, we can face whatever comes next with confidence, not fear. And while the question, will there be another pandemic, may never leave us, the answer to, are we ready, lies in the choices we make today.
That's it for today. I'm Lu Tsen, and this is your Health Decoded NZ. Clarity Unlocked, so you can make sense of the facts and see the differences for yourself. Please remember to subscribe and feel free to leave a comment.